let's get the event underway. So the Patient Safety First is a public awareness initiative aimed towards establishing a regulatory college for medical laboratory, radiation, and cardiology technologists. I would like to introduce our board today. Sitting directly to my left is Shauna Ryall.
Hello.
Beside her, we have Darlene Hyde, who is the Executive Director of the BCAMRT, the Association of Medical Radiation Technologists. To her left, Malcolm Ashford, Executive Director of the BCSLS, the British Columbia Society of Laboratory Science. And to his left, we have Cheryl McCullough, who is the President of the BCSLS. And I apologize, Shauna, for not introducing your position. And Shauna Ryall is the President of the of the British Columbia Cardiology Technologists Association. Well, a bit of alphabet soup in the room. So without further ado, I'd like to hand it off to our panel for their opening remarks.
Okay.
Shauna Ryall.
I guess that would be me first. Just to give you a brief introduction as to CTABC and who we are, we were formed back in the 1970s. In the 1980s, we identified the need for cardiology technologists to be regulated. And you would ask why? Well, I'm going to give you some insight into what we do. We work as healthcare professionals in providing tests in a variety of manners to people's hearts. Most would be familiar with an EKG that you might get if you think you're having a heart attack, an emergency, but we go far beyond that. We also test people's heart for risk stratification for a possible heart attack, as well as maybe future events to see what is happening. And we can provide this testing prior to having a heart attack. We also provide, more importantly and more technologically advanced services for pacemakers and ICDs, the instruments that can help keep your heart beating properly after you've maybe have had a heart attack or you have some type of electrical problem. And these are advanced skills, and you want to make sure that the people that are doing these things have the correct testing and the correct knowledge and have kept current. And this is main reason why we are seeking this. Also, when somebody steps into the stress lab, you want to make sure that the person who is reading what is happening to your heart during a test is understanding what is happening. Because let's face it, without your heart, you simply don't live. So we are strongly behind forming an umbrella college with the RadTechs as well as the lab technologists, as we feel that these are three critical areas of patient safety that exist. And medical advancements are ongoing, and we want to make sure that the people that are doing these tests really are keeping up to date with all of the latest changes. CTABC currently has, including student members, about 562 members that are actively part of our association, but we do know that there are countless people out there who are not a member of our association, and we question whether or not they are qualified and whether they are keeping up with their continuing education. And with that, I will pass it along.
Thanks, Shauna. Darlene Hyde.
Good morning. Basically, I represent over 2,000 medical radiation technologists in the province of BC, and we are joining with the BC Society of Laboratory Science, the Cardiology Technologists of BC, and the BC Ultrasonographers to advocate for a multi-profession college here in BC, a college of diagnostic and therapeutic medical technologists. Why are we advocating for this? Two key reasons. We feel the whole issue of continuing competency is one that needs to be addressed. Shauna mentioned it, but technology in these areas is changing dramatically, and it's important that whoever is doing these jobs, these very key technologist jobs, are up to date with today's technology, not just having written a certification exam 10 or 15 or 20 years ago, but they are up to date today with how to do things right. The second is the risk of harm. I can speak for the medical radiation technologists. They deal with hazardous substances, X-rays. The whole issue of dose is a very key one, and clearly risk of harm is one of the factors that prompts government to look at a profession in terms of regulating it. I might say that BC is one of 4 provinces right now where medical radiation technologists are not regulated, but in 2 of those 4 provinces, work is underway to make regulation a reality. The government has told us they have not been keen on regulatory colleges for a number of reasons. They need to see evidence of risk of harm, which concerns us because we don't want to create another Newfoundland situation in which people died because of bad lab testing. They feel that the health authorities provide sufficient supervision of many of these technologists, and we disagree with that. They've also suggested to us that there are alternatives to regulatory colleges and that we should have a look at them. We are eager to look at any kind of alternative which would result in regulation of these professions. So with these as opening comments, I will turn it over to Malcolm Ashford.
Thanks, Darlene. Good morning. My name is Malcolm Ashford, and for the last 5 years, I've had the pleasure of serving as the Executive Director of the BC Society of Laboratory Science, or BCSLS. Our organization is a professional organization in the healthcare system. We represent medical laboratory technologists and medical laboratory assistants in the province. Our membership right now is just over 1,200 members. We do not represent 100% of technologists and assistants in the province. Our organization is a voluntary organization, so we feel we represent probably close to a third of the technologists and the laboratory assistants out there in British Columbia, but there are several thousand of them that exist across the province in both the public healthcare system and the private healthcare system. Right now, British Columbia, from the lab technology perspective, British Columbia is the only province in Canada that does not regulate and license lab technologists and lab assistants for that matter. And we feel that is wrong. We feel we need to address that, and that's why our profession has taken a leadership role in pursuing a regulatory college. We have been working on this, believe it or not, for just over 20 years, and it's been a frustrating process. I guess we didn't want to rush into it, but certainly we've been working at it for some time. The most recent proposal that went into government was in July of 2007, and that proposal recommended the establishment of an umbrella regulatory college for both the BCSLS, for lab technologists, and working in partnership with the BCAMRT to also license and regulate radiation technologists. Since that time, we have been joined by the CTABC, the cardiac technologists, and we've also been joined more recently by the ultrasonographers in the province, all of whom feel that they would like to be part of a regulatory college for these professions across the province. And it's kind of interesting that this town hall meeting is taking place during Patient Safety Week, because we do feel this is a patient safety issue. And that is not intended to imply that all technologists, be they lab technologists, radiation, cardiac, or otherwise, that is not to imply that technologists in British Columbia are incompetent. In fact, what we're suggesting is just the opposite. We feel these technologists are an integral part of the healthcare team in British Columbia. We feel they should be recognized as such. We feel that continuing education and mandated continuing education should be critically important to all of us in terms of our professions, and we feel the regulatory college is one way of getting there. The other issue as well, if you look at it from the perspective of human resource planning, to ensure that our people work in an environment that is conducive to professionalism, we feel in order to be able to do some effective human resource planning in this province, we really need to know how many technologists there are around British Columbia, and we need to have a way of working with those people and licensing them on an annual basis. So that we feel there's a lot of good reasons to establish the regulatory college. I won't get into any further at this point. I'll leave it at that and pass it on to Cheryl McCullough, who is the president of the BCSLS.
Good morning. My name is Cheryl McCullough, and again, as mentioned, I'm president of BCSLS. I represent the board of directors on the BCSLS association, and I am a working medical technologist. And as Malcolm had mentioned, human resource planning is of utmost importance in our profession, especially due to the retirements that are happening in our profession, there will be a need for future technologists, not necessarily even those that are trained in Canada, but those that might be internationally trained and coming into Canada, and the need to have movement as well between the provinces. To have a regulatory college in our province would mean that we would be able to sustain and maintain some kind of training and safety and ethical standards of the professions, of the professionals coming into work in our fields. And the importance of the education portion of a regulatory college is to uphold that quality of care that we all know so well in our professions. And if something goes wrong, not to say that our professions are mishandle our opportunities in our job, but to protect the public should there be any ramifications of anything wrong with some of the dealings with some of the people in our profession. Although we're not licensed, we still consider ourselves all very qualified professionals. Yet we feel that by having a regulatory college, we will be able to maintain the quality of care that we so rightfully try to uphold day to day. And with that, I will pass it on to Michael Rogers.
Great. Thank you all for those introductions, everyone. I appreciate the backgrounder as to why we are here.